Hello everyone, it's Dr. Yu. Some of you will know that I'm a family doctor in Calgary, Canada, but what many of you may not know is that I'm also a part-time rural doctor, serving a remote rural community in Canada's Northwest Territories called Fort Smith. So when I saw Dr. Glaucomflecken's video about a medical student's first day in rural medicine, I had a lot to say about it. And in this video, along with my reactions to Dr. G, I'll take you on a tour of beautiful Fort Smith, including our health center and surrounding areas. And with that, let's watch this video together.
Knock, knock. Hi, I'm the new med student. Oh, come on in. Did you have trouble finding the place? Actually, yeah, quite a bit. Did you
He's
take
honest.
the fan boat out here?
So Fort Smith is a community of about 2,500 people. It's situated at the border between Alberta and the Northwest Territories, almost 300 kilometers from the nearest town with a similar population, pretty much in the middle of nowhere. It served as a uranium transport hub during the Second World War, and its legacy in the war is reflected by this monument in the center of the town, a boat called the Uranium King, one of the uranium transport boats. Our health center here is staffed mostly by a dedicated nursing team, along with midwives, a physiotherapist, an occupational therapist, a social worker, and several mental health counselors. We only have 3 to 4 doctors here at any time, and most of us work on rotation, coming up from various parts of Canada. And did I mention, in the winters it's freezing cold. It can get down to minus 50 degrees Celsius or minus 58 degrees Fahrenheit. But as I'll get into later on in the video, Fort Smith lives true to its town slogan, unexpected, unforgettable. And it's not just because being unable to feel your face at minus 50 degrees Celsius is something that's hard to forget.
Did you take the fan boat out here?
To come here, I have to fly from my home base in Calgary up to Edmonton, the capital of Alberta, then take an 18-seater propeller plane from a regional airline called Northwestern Air Lease, which is based out of Fort Smith and connects the town with a few larger Canadian cities. These planes are small but functional. Just don't fly them through a storm. Your stomach will never forgive you.
Yeah, the fan boat operator kept asking me if I wanted an MRI. That's Texaco Mike for you. Texaco Mike. He's a bit stingy with the contrast, but his diffusion-weighted images, no one does it better. Okay.
Texaco Mike seems to be their jack of all trades, a boat operator and a diagnostic imaging technician. This is quite typical of rural communities. For example, the flight's first officer doubles as a flight attendant and baggage handler. My colleagues in the hospital have multiple roles as well. The physician scheduler doubles as an executive assistant and driver. Nurses here work both the hospital emergency department and the inpatient acute care setting simultaneously. Community health nurses manage all sorts of things that normally doctors would, from vaccinations to chronic disease prevention and routine screening examinations. Lab technicians do double or triple duty, running the x-ray machines as well as drawing blood themselves.
Anyway, welcome to rural medicine.
I'm so happy to work here, and I'll explain why throughout this video.
What do you want to do while you're here? I'm sorry? Deliver a baby, fix a broken leg, admit a patient with sepsis, do a central line mental health counseling. What do you want to do? You know how to do all those things? Yeah.
In Calgary, I work in an office-based family practice, but in Fort Smith, I see patients via our outpatient clinic, look after them as hospital inpatients, see them through the emergency department, as well as see patients through our local long-term care center. I've treated heart attacks, pulled objects out of eyeballs, done all sorts of injections, inserted chest tubes, performed minor surgeries, fixed broken bones, pushed hernias back into place, talked patients out of suicide, and pulled an engagement ring off a pregnant lady's swollen finger. All things I don't normally get to do in my practice in the city. The only thing I don't do at Fort Smith is obstetrical care. We have a dedicated team of midwives to help with that, and they are excellent.
The nearest tertiary care hospital is 200 miles away.
So matter of fact. What the rural doctor here is talking about really speaks to me. He's talking about the difficulties of providing quality healthcare in a rural and remote environment. Here, people and healthcare services are so spread out, it takes 3 hours minimum by car to drive between communities. And we're also limited by our supply of medical resources. For example, in Fort Smith, we don't have the capacity to run all the lab work that we want. In the emergency department, we can only run troponins to rule out a heart attack. We can't run a D-dimer to rule out a blood clot. There is no CT scanner here, and definitely no MRI. And we have no ventilator. So if somebody becomes unconscious and needs ventilatory support, myself or my colleagues must use a bag valve mask device to manually ventilate them until help arrives. For us, the nearest tertiary care hospital, where heart attacks and strokes are treated, and where the big surgeries are done, is Edmonton, 700 kilometers away and a 2.5-hour plane ride, or a 13.5-hour drive.
Well, what if something comes up that you don't know how to do? We're in the middle of nowhere, but we still have internet.
Yes, we do have internet. And in the Northwest Territories, the government actually pays for an expensive, internationally used medical education resource for doctors called UpToDate. This allows us to have access to, for lack of a better word, up-to-date medical information so that we can provide care to our patients even if we need a refresher in a topic we didn't initially know much about. Now, if anybody in Fort Smith is watching, I want to reassure you that all the care we provide is safe because we always consult our specialist colleagues in Yellowknife or in Edmonton if ever we are unsure about how to provide the best quality care. Another cool thing about working here in Fort Smith is that the entire Northwest Territories has just one shared electronic medical record system. Healthcare information flows in a streamlined manner throughout this entire part of northern Canada, making the delivery of healthcare that much more efficient. This is something that I wish that other parts of Canada could learn from. It makes care so much easier for patients who have to move between communities because the doctors in each community can see all the records from where the patient used to go before. A specialist in Yellowknife will have access to all the patient's medical information so that we don't have to describe for them what we see on the x-ray. They can see it themselves. I want to quickly acknowledge the person who coordinated all of this work, Dr. Ewan Affleck. Yes, a distant relative of Ben Affleck. Dr. Ewan spent 10 years developing this initiative, coordinating all the stakeholders to shape it into reality. For this work, he was recognized with an Order of Canada, and I'm proud to call him one of my most respected mentors.
Patients are okay with you just learning how to do stuff on the internet?
There are limitations in how much a doctor knows. I'll be the first to say that I don't know everything. We are doctors, we have years of training, but we are all human. So when I don't know something, I bring up to date, and I look through it alongside my patient, and we learn together. My patients like it because it's very transparent and it's patient-centered care. And I'd say that in rural settings, patients are generally more okay with doctors needing to look up information than patients in the cities. The patients in Fort Smith are generally kind, patient, and definitely not entitled, since unfortunately, access to healthcare is a luxury for many here.
This is a farming community. You know that, right? Yeah. Have you ever told a farmer to drive 3 hours away to get a lumbar puncture? No. He'll say, okay, then drive his tractor home and do it himself. Oh my God.
We are not a farming community, but we do have many people in our community who live off the land. They hunt moose or deer for their meat, and they have to cut down trees and chop wood to provide a source of heat for themselves and their families during the winter. And when they go off hunting in the Canadian wilderness, their phones don't work, and so oftentimes we have great difficulty getting a hold of them for their screening examinations. So we actually don't know if they're doing their lumbar punctures themselves. Hopefully not. Health, especially preventative health, is a secondary issue to many of them. Survival comes first.
Worst case scenario, a patient's really sick. I just fax Texaco Mike and he fanboats the patient wherever they need to go. Texaco Mike. That man fanboats like the wind.
Worst case scenario in Fort Smith, we got on the phone with a specialist in Yellowknife or Edmonton, and they send an air ambulance known as a medevac, medical evacuation for short, which brings the patient out of Fort Smith and into a larger hospital. Now fortunately, these medevac airplanes do have ventilators on board.
Hey, Doc, little Eli's in room 3. He's got an ear infection. Again? All right, give him a sticker. I'll be right there. Hey, Doc, Jimmy from down the road. He's in room 7. He's feeling a little bit dizzy. Yeah, check his blood sugar. Tell him I'll be in there in a bit.
When I'm on call, I'm oftentimes the only doctor covering the inpatient ward, the emergency department, and our local long-term care center. This video does a great job highlighting the fact that as a rural doctor, you're oftentimes the only one on the job, and you're often pulled in multiple different directions at once, and you have to know which patients can wait and which ones can't.
Hey, Doc, do you have any more of that anti-venom? Bee, snake, or spider? Possum. Here you go. Thanks. Wait, possums have venom? Our possums do.
So things just happen in a rural community that don't happen anywhere else. For instance, Fort Smith is situated beside one of Canada's largest rivers, and every summer the pelicans migrate up here and go crazy. We're also home to one of Canada's largest paddle festivals, and people come here to paddle in our rivers from around the world every year. On a less positive but still unique note, I was working in Fort Smith during not just one, but 2 gunman standoff situations that happened in the town over the last few years. During those times, the town required us medical providers to be on alert for mass casualty situations. It was scary, and fortunately a mass casualty didn't happen, but one of those situations did lead to a death, which was very tragic to the town. Another tragedy that happened to Fort Smith are the wildfires in the summer of 2023. In August of 2023, the entire town was evacuated. Our local firefighters, in conjunction with firefighters from across Canada, did a great job in preventing damage to the buildings. And even though no buildings were lost, being forced away from your home for a month is jarring to say the least. But what makes Fort Smith so special to me is the sheer resilience of the community. When these tragedies happen, the entire town pulls together and everyone helps each other. There is just this great sense of community here that we don't feel in the big cities.
Excuse me, doctor, Sally's on the phone. She wants to know when you're going to deliver the mail. Couple hours. You also deliver the mail? Yeah, who else is going to do it?
Fortunately, in Fort Smith, there are dedicated Canada Post staff who do the mail delivery. But again, this speaks to the multifaceted roles that rural physicians have to do, working in the clinic, emergency department, inpatient ward, and the long-term care center.
All right, why don't you go see that kid? I have a mayoral re-election debate to prepare for. You're the mayor? For now. I'm running up against a goat who's got some pretty impressive ideas.
Just hilarious. Totally rural medicine here. When I come to Fort Smith, I'm often shocked at just how different a world rural medicine and rural living is compared with city medicine and city living. It's not for everyone, but for the people who live here and for the people who come here, we love it. So why do I come here? Well, medicine here is very down to earth and very back to the basics. You use your knowledge of how to take a patient's history and how to conduct a thorough physical examination to do as much as you can for the patient without requiring any advanced imaging. Again, I get to do so much more medicine and see so many different cases here compared with what I get to do in the city. It helps me stay sharp, forces me to learn every day, and I love it. For me, there's also a sense of giving back, and that's because Fort Smith is a community with over 50% of the population being Indigenous. Canada has a long history of not being very nice to its Indigenous peoples, and that legacy is reflected in the healthcare system today. I once had a lady who was Indigenous who had a 4-inch long gash in her arm. She was forced to go to the emergency department by her daughter. She didn't want to go. When I was talking with her and examining her, I learned that she was a residential school survivor, having grown up in one of those schools that took away kids from their families and exposed them to negligence and abuse. It's no wonder then that she was distrustful of the medical system here. But as I stitched up her arm, I reassured her that she's safe and that things were going to be okay for her. And hopefully that created a positive environment for her. And so, patient by patient, I hope to help the Indigenous peoples of Canada and do my part in Canada's attempts at reconciliation. And that's it for my reactions to Dr. G's video about a medical student's first day of rural medicine. Practicing in Fort Smith is indeed unexpected and unforgettable. And as a city person all my life, I'm proud to call myself a rural convert. What do you think about healthcare in rural versus urban settings? Let me know your thoughts in the comments down below. I look forward to hearing from you. If you enjoyed watching this video or learned something new, please hit like and subscribe to my channel. I'll see you in the next video.